I'm now pleased to introduce to you today's speakers, Shane Ember, Marcia Murray, and Ella Moore. Marcia Murray, MS, is the current State Youth Coordinator for DCF's SAMHSA CSAT State Youth Treatment Implementation Grant. Ms. Murray has assisted in the development of a comprehensive strategic plan to improve treatment for youth and young adults with substance use or co-occurring substance use and mental disorders. In her current role as a State Youth Coordinator, she provides staff support to the state's Alcohol and Drug Policy Council, statewide adult substance use financial mapping, facilitates youth-family community conversations, and provides project coordination for the ACERT project. Ms. Murray was also recently published in the Journal of Racial and Ethnic Health Disparities. Shane Ember has been the Connecticut Statewide Youth Recovery Support Coordinator at Wheeler Clinic since May 2020. In their current role, Shane coordinates the CROSS initiative, which provides mini grants to local agencies and community organizations to start SMART recovery meetings for teens and young adults, SMART family and friends meetings for caregivers and alternative peer groups. Shane also coordinates the CROSS network, which continuously supports current and past mini grant recipients for sustained success in serving youth and families affected by substance use throughout the state of Connecticut. Before starting at Wheeler, Shane was the recovery team advisor at the Children's Center of Hamden. The recovery team provides free case management, recovery, coaching referrals, outreach, and wraparound support for teens who use substances and their families. And now Ella Moore joined turningpointct.org as the project coordinator in 2020. Ella uses her personal experience with anxiety, depression, and unhealthy coping mechanisms to provide support and resources to her peers. She coordinates Turning Point CT's online and direct work, including interactive online web resources, social media, and speaking engagements at schools and universities. And enjoy your session.
So just to begin, currently in Connecticut, there are several levels of public services to help families with support of youth recovery for substance use disorder. These services can be provided in the home or in the community, and they also often prevent the need for more intensive care. The Connecticut Department of Children and Families and the Department of Mental Health and Addiction Services offer a variety of these services to state residents. And because we understand that it can be challenging as a parent who may be searching for help in this area with a teen that is using drugs or a young person that is in crisis, this online resource was established to help. So the resource that I'm sharing today is the Live Loud Families website. This website was created to support families and caregivers and other loved ones attached to young people who may be using substances and struggling. The Live Loud website describes Connecticut's substance use treatment options for youth, as well as support groups for young people and loved ones. The website also has a video library that actually has videos like these that are describing the resources here in state, as well as providing information and guidance for young adult and youth substance use. Also, you can visit the Live Loud Families website by typing in your browser liveloud.org/families, or visiting the Facebook page by typing in Live Loud Families. We continue to add more resources there, so we welcome you to visit when you get a chance to see more videos like this, or just to really stay up to date with the information in the area of what Connecticut's doing to help young people stay in recovery. So at this time, I will hand it over to the next presenter.
So my name is Shane Ember. Thanks for the introduction, Annie, and thanks for the first introduction to the resources in Connecticut, Marcia. And so I'm talking about the CROSS initiative, which is also known as the Statewide Youth Recovery Support Network. And so this is for teens, young adults, and their support. So mostly caregivers, but it could also be peers. So I threw up this slide just in case people are curious how it started, but most of the talk that I'm giving, it's for parents, caregivers, or any kind of supportive person in a young person's life. That's really, what you need to know about these meetings. But basically there was a need identified for youth-specific recovery support in Connecticut. So we have a lot of good options for adults in the state, and that's been true for a long time. But there hasn't been very much that's specific for young people until fairly recently, as far as peer support. So there's been a lot of treatment options for a long time, but as far as peer support, there wasn't like any kind of organized push to have them. So using funds that have essentially come from the federal government for the state opioid response, we have some of those to help organizations that already work with teenagers and young adults and families to start these meetings. And so this presentation, it says Wheeler all over it, and that's because Wheeler Clinic has basically been contracted to administer this grant. But this isn't the most important part. I just put it up in case anybody's interested in how this got started. The real point is that there was a lot of people in the state who said, we need a youth recovery support network in Connecticut, and we want to make it happen by giving mini grants to these organizations. And if they get the mini grant, then they're going to start a SMART recovery meeting for teenagers or young adults or both, alternative peer groups, and SMART family and friends meetings, which are for caregivers or really anybody who's a support to someone who is using substances. And then I'll be explaining what all of these are. So first is SMART recovery meetings. So SMART recovery meetings are mutual self-help peer support groups. And what that means basically is it's a group of people coming together who are trying to change their behavior, and it's mostly for substance use, but it's really for any type of addictive behavior. So it turns out that people can get addicted to things besides substances. So for example, if somebody is working on a gaming addiction, they can come to SMART recovery and get help with that. The tools in SMART recovery are evidence-based, which basically means that they're based on research. So these are the same kind of tools that you would get if you went to like an outpatient treatment program, except for that they're taught in like a self-help kind of way. So the facilitators for the meetings might be a therapist, or they might be somebody who's just been trained as a facilitator, and they might be someone who's actually in recovery themselves. So for example, I used to facilitate meetings at the Children's Center of Hamden for teens. I still facilitate meetings for adults in the state. And I'm not a clinician or anything like that. I'm a person in recovery who became trained as a facilitator. I'm also a recovery coach, and I facilitate the meetings. And so it might be someone like me facilitating the meetings. And the meetings are free. And that's a really big point. So some people think of it as like analogous to AA, where it's like a weekly meeting, but the structure of the meeting is totally different. And the emphasis is really on self-empowerment and doing what works while it's working. And one of the cool things about SMART, well, there's 4 things that I put up on the slide, but one of them that I think is really important is that crosstalk is encouraged. So in other types of meetings, the safety of the meeting is preserved by not letting people talk to each other so that they can't like accidentally hurt each other's feelings or something like that. But in the case of SMART, the facilitator is trained to kind of keep the meeting safe and help people remember to say, you might want to try this because this worked for me, or when I had that same problem, this tool helped me. That's a better way to say it. And that the whole thing is that peers are helping each other. And so if anybody here or who's watching this is a parent, you might have noticed that you can tell your kid a bunch of times, to do something in particular, but as soon as they hear the same thing from their friends, they actually listen. And so that's kind of part of the idea, is that they're learning from each other. Another thing is that involvement of spirituality is optional, so people can involve their spirituality if they want to, and that's something that's important to them, but it's not necessary. And we think this is important because a lot of young people do identify their religion as none, and so basically it's just reducing that barrier if it is a barrier for anybody. Another thing is the avoidance of unhelpful labels like addict or alcoholic. And if people find the labels helpful, then they can use them. But again, they don't have to. And so that does reduce barriers, especially because a lot of young people will say, I'm not an addict, I'm not addicted to marijuana, I just use it, I can quit anytime I want. And that way they don't have to say they're an addict to come to the meeting and get help. They might just say, you know, I want to smoke less than I have been, or I don't want to smoke. And it is an abstinence focused program. So the goal is to stop doing whatever the behavior is, if that's possible. If somebody has a food addiction, obviously it's not possible. But, you know, if somebody is working on it, they can still come to the meetings. And then the last thing, and this is really important for young people who are using opioids or are trying to quit using opioids, is that medication-assisted treatment, so MAT, like Suboxone or Methadone, is explicitly supported by Smart Recovery. And so people can come to the meetings and say, you know, I need help from the group on how to be taking my Suboxone as prescribed and taking it regularly. And so that's something that isn't necessarily true of other types of programs. So if you're a parent or a caregiver and you're, you know, saying, hey, you know, to my child, why don't you check out these Smart Recovery meetings? They might say, I don't know, that sounds scary, but I wanted to just put a little bit up here about what it's like, because it's actually not scary. It's not like a therapy group, it's really a peer support group. So it's a relaxed atmosphere. There's no pressure. In fact, people don't have to participate. They can come and just listen. There's no stigma, there's no shame. Like I said, there's no labels. People are really supportive. And it's really practical. So you're learning helpful strategies that can help you meet your goals. And your goals might not necessarily be when you first start coming to stop using, but it might be to cut back to the point that your mom gets off your back, you know. And so it's whatever their goal is, they can work on that in the meeting. So the structure of the meeting is everybody comes in, you're usually sitting in a circle, or now a lot of the meetings are on Zoom, and the facilitator will explain what the SMART meeting is going to be like, and you'll start with a check-in, so you can say what's been going on with you lately and what do you want to work on today. And then the main part of the meeting is working time. And this is where the participants are helping each other. And the program is broken down into 4 points. So it's building and maintaining motivation, coping with urges. And so that also means like triggers and cravings, managing thoughts, feelings, and behaviors. So this is the kind of thing where, you know, a young person might come in and say, I had a fight with my boyfriend or girlfriend, and that really upset me. And then I ended up using. And so the managing thoughts, feelings, and behaviors is like, when we get triggered, what do we do? How can we change our thoughts and feelings so that we can change our behavior? And then the last thing is living a balanced lifestyle. And then the working time, everybody's helping each other. There's lots of tools under each of these points. So they're learning things like, what are practical things I can do when I have a craving? And that could be something like distracting yourself with TV. It could be calling a friend, you know, all sorts of things. Doing a worksheet from the SMART handbook. And then once we finish the working time, everybody gets to check out, which is kind of a cool thing in SMART, and then set a goal for the week. And by checking out, it's just basically saying like what was helpful for you in the meeting. So they're really relaxed. If somebody wants to come and they don't want to talk, they can just say pass anytime, you know, you're going around a circle. And often when they see that the other people in the room are dealing with the same kind of stuff, then they feel more comfortable and feel like they want to participate, but it's not necessary to do that. Other people can come to meetings for weeks and not participate at all and still get a lot out of it. So I just wanted to put that out there in case there's anybody who's not sure but maybe wants to check it out. The other thing is that's for the young people, for the teens or young adults, is the alternative peer groups. And alternative peer group is kind of like a clinical term, but basically what it means is like a facilitated, safe, new friend group. And so the idea behind it is when teens and young adults, and this is also true for older adults actually, when any of us decide to stop using substances, we often have to stop hanging out with friends who still use, but we might not be accepted or supported by peers who have never used. So this happens more with young people, I would say. So like, for example, if someone is suspended from school for something substance use related, and then they go get treatment, they get help, and they come back to school. They're trying not to hang out with their friends that are still using, but their best friend from middle school who has never used drugs might not be allowed to hang out with them anymore because they've been labeled a bad kid or whatever. And so what the alternative peer groups do is facilitate the formation of a new friend group that is going to be supportive of sobriety and accepting of where people have been. And besides just making new friends, which is a really important thing, the alternative peer groups can be a gateway into smart recovery meetings. So they might come to the hangouts, meet the other people, say, hey, this is actually okay. This is you're all actually kind of cool. And then they might start going to the smart recovery meetings. Another thing is just relearning how to have fun while sober. And this might sound kind of odd, but for somebody who maybe has been smoking marijuana for a long time, they might kind of feel like they don't know what to do to have fun without involving drugs. Another thing is building up social skills and learning things like conflict resolution. And this is a really big one, I think, because a lot of the times when people are using, it's kind of self-managing in a not so effective way, social anxiety. So it can just be a way to get comfortable being around people again while you're sober, which is really important, and learning new coping skills. So what I mean by that is that you're learning new coping skills by just learning new things to do with your time. So again, what are the APGs like? They're free. That's a big point. They're fun. They're sober, so nobody's going to be using while you're there. And they're supportive. And it's hard to really summarize exactly what they are because all the different sites or all the different organizations throughout the state do different things in order to meet the needs and interests of the group. And so a lot of times it's actually the people in the group, the teenagers or young adults, who are actually deciding, hey, what is our next event going to be? But some examples of activities are a sober party held on a college campus that's at the same time as another party where substances might be served or used. And so some of the biggest alternative peer group events have actually just been parties on college campuses where there's no drugs or alcohol. Another thing is outings. So I've seen alternative peer groups go to movie theaters, bowling alleys, trampoline parks, fast food restaurants or sit-down restaurants, ice cream shops. There's also arts and craft nights. So I've seen tie-dye, learning to knit, painting, pottery making, and scavenger hunts, escape rooms. It's really just like fun things to do, and it's maybe something that you don't usually get to do or something that you never really thought of, like the learning to knit, and then you can use that as a coping skill on your own. And so alternative peer group is the, like I said, the clinical name, but a lot of the, for like what these are, but a lot of the groups actually have their own kind of cooler sounding name. So for example, one of them is called Peace and Chill Crew. That's the one at the Children's Center of Hamden. And that was named by the teenagers who are involved in it. And it's basically just, you know, a place like to hang out with chaperones and fun activities and food. There's almost always food, which is a big draw. So again, if you are a parent or caregiver of a young person who's like, I don't know about this, you know, just be like, hey, it's like fun, you know, like it's no pressure. Just check it out and, you know, you might like it. And one of the stories I like to tell is we, at the Children's Center where I used to work, we had just started the alternative peer group. We had a few people coming every week. And then we had an event where we were going out to an all-you-can-eat buffet at the Golden Corral. And suddenly, instead of having like 3 or 4 or 5 people interested in coming to the event, we had 12 people who wanted to come to the event, and we had to like, you know, just, it was just like a little bit more logistically difficult to figure out how to like feed and pay for and transport 12 people, 12 teenagers to come to an all-you-can-eat buffet. But that's the kind of thing. And then they came, they had fun, they saw that it wasn't pressury, it wasn't weird, and they ended up coming to more of the events and also to the Smart Recovery meetings. So that's an example of the kind of thing that we do. And then the last piece, and this is for you all, this is for the parents, the caregivers, or the supportive friend, or the aunt or uncle or grandparent who just loves their young person and is worried about them and worried about their substance use. This is the group for you. This isn't for them, this is for you. So Smart Family and Friends can be considered or thought of as analogous to Al-Anon, which is the 12-step version for the family or friend, but it's actually very different in a lot of ways. So it's based on CRAFT, which is It's short for community reinforcement and family training. And that's not the important thing to know, but what is important to know that it's, again, evidence-based tools, and it's for families to support their loved one who struggles with any type of addictive behavior. So the very cool thing about craft is that the research about craft shows that it's very effective. So, and this makes sense, right? And I'm really glad that we're doing these Help Us Here series in general, because if you think about it, the most important support in a young person's life is usually their family. And even when the young person starts to, kind of go down a path that's not healthy, oftentimes the person who's most able to bring them back is their family. And that's the whole idea of this, is that by empowering the parent or the caregiver or the close friend or the cousin or whoever is the closest person to this, the person that has an addictive behavior, is you're actually really increasing the likelihood that they will get help. So it turns out that people who do craft, so if the parent is going to Smart Family and Friends meetings and practicing the tools, their child has a 60% chance of getting into treatment. So that's a really high success rate. There's really nothing else with that high of a success rate. And so it's not a 100% chance, but the best thing you can do if you want to help your young person in your life who's using substances is to do this program. And the cool thing is it also will help you feel better. So when they studied it and they found the 60% of people with the addiction end up getting help if their family member is doing this program, they also found that even if their family member didn't get help, if they were one of the 40%, then the person going to the program still felt better. So the structure of Smart Family and Friends meetings is really similar to the Smart Recovery meetings that I was just talking about. So there's a check-in, there's working time. It's people who are like you, helping you learn these tools, and it's structured tools that you practice doing, and there's a checkout, and you set a goal every week. And the emphasis is on self-care for the caregiver. So it's really this like oxygen mask rule thing. It's that you can't help somebody else unless you're taking care of yourself first. It's about maintaining positive communication. So it's really about alternatives to nagging, begging, threatening, like all the things that we do kind of automatically when we care about somebody who's making decisions that we're concerned about. It's learning how to communicate in a way that's actually positive and it's been shown to be more helpful. And it also feels better to you because nobody likes to nag their loved one. And the last piece is about setting and keeping healthy boundaries. And none of this is about cutting off your loved one or letting them hit rock bottom, which I think are things that especially don't work for young people. And it might not even be really ethical to like cut off your 16-year-old, for example. But it is about setting boundaries and helping in a way that's going to help, and learning how, like, which kind of boundaries are helpful. So it's a really, really cool program. I definitely suggest check it out if you're interested. Recommend it to people. People who do this program really like it, and it's just I can't get enough of this program. Like I'm a person in recovery myself, but and a lot of people in recovery say the same thing as I'm about to say, which is like, I wish people in my life had this program when I was going through it. It's very cool. So another point I want to make is just that there's lots of groups. So this is the map of the groups throughout the state. There's 36 groups. And so where it says 36, that means there's 36 either teen or young adult Smart Recovery meetings, and each of them also have a family and friends meeting. And it's at 30 unique organizations. So some organizations have started multiple groups, either at different locations or different age groups. And the organizations, they're all nonprofits. There's youth services bureaus, high schools, colleges and universities, nonprofit mental health and substance use treatment centers, community organizations, and even prisons. So we have Smart Recovery groups and family and friends groups in 4 different prisons in the state of Connecticut, and we're working on actually getting that to be a higher number. And we actually are still recruiting new organizations. So if anybody knows of any organizations who might want to apply, definitely you can connect them with me. So I'm about to wrap up. I don't know where we are on time, but all of the meetings are currently held online, like on Zoom or they're outdoors because of COVID-19. And also all of the APGs have continued to be held in creative ways. So some of them are outdoors. I think a lot of them are doing online engagement, which is really cool. One site did this virtual scavenger hunt, which got a lot of participation. Another one, or actually it was the same site, I think, who did a crazy hair day with incentives. So basically everybody like did their hair in like the most creative way they could and voted on it, and then whoever won got a gift card for a fast food restaurant. So it's kind of cool. But basically I wanted to say that everything is still going even with social distancing. And then the meetings are also thinking about how to be held in a hybrid way, you know, as we start to kind of transition through the pandemic. And then also, you know, they'll be kind of back to normal whenever that is possible. And as far as how do you get connected? So this is kind of the transition over to the next presenter, Ella. But all of the meetings or groups are listed on turningpointct.org, which Ella is going to talk about. Cross will also have our own website soon. And so I'll try to get that posted on the Live Loud website as soon as our website is done, Live Loud Families. And if you go to Turning Point or you search online and you are having trouble getting connected to a group, you can always reach out directly to me. And this is my email address. It's sember@wheelerclinic.org. And that is it. And it's just my name and my email address one more time. And thank you so much. And now I'm going to pass it over to Ella.
Welcome to this end portion of your training tonight. So I am honored to be presenting on behalf of turningpointct.org, which is Connecticut's mental wellness project by and for young people. My name is Ella Moore. I am a young adult with lived experience of mental illness, and I'm also living in Connecticut. So personally, I wish that I had found out about this project way earlier in my recovery journey, just because it can provide some really awesome resources and connection. So I'm excited to share the ways that Turning Point CT can help you. Okay. So how can we help? Some of the ways that we can help are empowering young people, demystifying the mental health system, and connecting with peers who are also struggling. So although we are not clinicians, we know what it's like to feel alone, stressed, worried, sad, or angry. We've lived through the ups and downs of self-harm, drugs and alcohol, and the struggle to find help. And fortunately, we found what worked for us. Our goal is to provide information and support to help you choose your path so you don't have to struggle the way that we did. So with that being said, I want to also talk about what we're not. So what we're not is a call service or a warm line or hotline. So if you do need help, I would jot down these numbers. They're really awesome just to have in your contact book, in your address book, just to have on hand if in an emergency. So the first number listed is the National Suicide Lifeline. The second is the crisis text line, and the third really cool option is the Young Adult Warm Line, which is just for young adults in Connecticut, which is developed by Join Raise B at Advocacy Unlimited to connect young people to community resources, motivate peers to move forward, and inspire hope by demonstrating the positive outcomes of recovery. So the number for that is written on the slide, and they're available 7 days a week, noon to 9 p.m. So that's a really great option just if you need to talk to a peer, if you want to get something off your chest, basically. So let me start by talking about the ways in which we empower young people. So our website serves as a platform for elevating and empowering young people's voices and experiences. So young people have the opportunity to submit their stories, showcase their artwork and videos, and even participate in our podcast. So I want to show you a snippet from one of our podcasts, which features Kernan, who is a young adult in recovery for co-occurring disorders. She was one of the project leaders before me on the project, And yeah, I'll just pull up a little snippet of that. Let me know if everybody is able to hear it.
I remember when I first tried to get sober, I was like, I heard about medications and I tried to go on them, but I would take the medication, but I wasn't working on my recovery internally. I was just working on it like physically. So I didn't really take my recovery serious because I still wanted to use and I still wanted to, I wasn't trying to get more recovery support. I just thought that the pill would fix it or the medication would fix it and that would be that. But in reality, I was ignoring everything else that was fueling my addiction, probably more so than the physical aspects of it. So, or at least the physical dependency of it.
So that was just a really quick taster of what you can find in more of our podcasts. And a little note about that is that you can find our podcast on the Media Room on our website. We're also hosted on Spotify, Apple Podcasts, and Google Podcasts. So you can really find us anywhere. Super accessible if you want to check us out. So let me briefly show you where you can find that on our website and kind of do like a little walkthrough of some other of the features that you can find. So I'll pull up our website here. Okay, so very awesome website, aesthetically pleasing, we love it. So basically, I'm going to show you the media room right now. And here, like I mentioned before, there's places to submit your artwork. You stay up to date with anything that's kind of going on with our project at the moment. Here are our podcasts. As you can see, we have like a range of different topics. It's usually centering around something to do with like mental wellness, but it ranges to whatever our young adults are interested in talking about, because really we just want to provide this platform to elevate their voices and empower them to talk about what's important to them. And as well as creative expressions. So here you can post your visual art, your poems, whatever it might be. We do have a lot of people that submit like their recovery poetry, and it's just a really nice place to share like some art therapy and yeah, it's a kind of holistic sense of wellness. And we also do create some videos. These are all coming directly from young adults in Connecticut, sharing coping skills, Friday favorites, their turning point moments, and we even host some discussions. So these are all great things to look out for. But in terms of you're a caregiver or a parent or a loved one of somebody that is struggling right now, and let me tell you how we can help in that respect. So I'll bring you back to the beginning. And this is how we can demystify the mental health system kind of in general. So we wanted through this website to create a space where information was unbiased, freely available, and kind of targeted directly towards teens and young adults, since there was a kind of gap in that respect. So you're at the beginning of your journey and you don't really know where to begin. A great place to start is our Q&A guide. And I'll walk you through this. Questions for feeling better, who can help me, how do I access services, what should I expect, and how can I manage on my own? So we have quotes directly from young adults, self-assessments, videos, statistics, and then we dive into where the majority of the information really is. So let's say you want to find out some more about wellness. So I'll take you over here. And you can see that each section really goes into a lot of depth, talking about, like what's a recovery plan or spirituality. So it really takes a look at all the different kind of aspects of what wellness is. And if you look back over here, we go into advocacy, detox and crisis intervention, family support, peer support, where you can find information like what Shane was talking about smart recovery, supplements, medication, other therapies, and talk therapy. So the next section, we have who can help me. And this ranges from the very beginning, like why should I even talk to someone? And then what do I say to my family? What do I say at school? Who can help me in my school? Like all really big, important questions that are on the minds of teens and young adults. And everything's just really easily laid out for them. And then to the next part, we say, how do I access services? So what should I do first? We have it all broken down for you, as well as all the other steps here. And then in this section, we have what should I expect, which is also a huge barrier in seeking treatment, is just knowing what to expect. So everything basically ranging from what should I, will I feel like this forever, like just generally about your mental illness, to the specifics of what should I expect from my family or friends, what should I expect from insurance, just really big questions kind of taken down and simplified. And then how can I manage on my own? So this is a section where you can find about a lot of independent living skills. How do I take care of myself? What do I do with all these feelings, etc. And each one of these individual sections has so many more like layers that you can dive into. But I'll let you all do that on your own time. Okay, so the next area that I'll take you over to is the facts. And here we have another interactive section. So this kind of goes over all the general things you should know about mental illnesses and co-occurring disorders and substance use. And specifically, I'd like to take you to treatment. And here you can see like even more information about like what all of these specific names and things that you hear about are. And I'll take you over to resources where you can find out about more of these treatment options and like what these actually look like in the state, local, or national resources. So we have all of these call centers and crisis lines listed, as well as our map, which is a really great function on our website that was added in a little bit later to our website. But we worked with a team of young people across the state to develop a map of social, recreational, and clinical resources for young people around the state. So this has come directly from teens and young adults in the state talking about the things that they do for fun, where they get their treatment. Basically, it's a place that you can add in where you've gotten treatment, where you've had fun. You can see we have a directory of kind of the general things that you can find on here. And specifically, we can look for smart recovery. And while that's loading, you should also know that you can add in these listings yourself. You can add in reviews to anything that you've actually done or participated in. And yeah, so we can see here we have all of these smart recovery groups listed. Everything should be up to date. And the one near me is Norwalk. So we have the meeting link, the times, and everything you kind of need to know about smart recovery. And you can find this for kind of any treatment around the state. It's just a great resource to dive into and see what's in your area locally. So yeah, and then the last function of our website that we can help provide you with is connecting with other peers who are struggling. Peer support, as Shane was saying, is a really important aspect to recovery. It's vital really to have that peer connection with people that have similar or shared experiences to you. So first where I'll take you is to the Our Stories page. And here you can kind of get and receive hope and also give it. Sorry. So here we have stories from individuals all around the state, ranging from all kinds of different mental illnesses and conditions, even for people that don't identify as having a diagnosis. So it's really for anybody to share their story, which is a function you can do over here, just to show you. And then if you go into one of these stories, we'll take Alex, for example. This is actually Alex from the Warm Line. He works at the Warm Line, so that's also a peer support service. You can see all about his story here, and it will connect you to the forum. And our forum is another place where you can connect with other young adults and teens, and kind of chat with them. So that specifically takes you to the function there. And I'll show you some of the blogs that we have up in here. So within each of these different categories, we have different conversation topics and stuff which you can feel free to join in on, follow along, subscribe to. But something cool is the blogs. So this is a blog from Ali, who you heard from in the podcast. And this was a really popular blog while she was writing it. And there's just lots and lots of content that you can read back on now and kind of follow along her journey with her, which is really awesome because recovery, as we all know, is not straightforward. And it's really great to hear directly from young adults and teens going through it to, you know, feel a little less alone. And that's really what we try and do at Turning Point CT, is just help you not feel so alone and not feel so daunted by getting treatment and getting help. So with that being said, I will go back over to my slideshow. Our project is a peer project, basically. So we need the interaction of our peers to kind of sustain us and keep us going to make us what we are today. So some things that your young adult or teen can do to get involved with us is to follow our social media for updates, check out our website in general, to share a story, upload art, add to the map, and even join us for a podcast. So if you have any questions about that, feel free to reach out to me personally or anywhere on the website you can find us. But yeah, that is everything that I have for you all this evening. Thank you so much for your time.